pediatrics unit, which I had requested. I didn't feel that I had enough experience through my clinicals here at St. Cloud. I would like to have had more hours in pediatric care. So I was lucky enough to get on their peds unit. Some of the other nurses ended up with GI, and I don't know what all. I was glad I didn't get on that unit. Anyway, it was only an 18-bed unit because St. Mary's had the bigger pediatric department. But we saw people or kids with mild things like just to get their tonsils out or wisdom teeth out, because that's way back when, when we could still go to the hospital for those procedures, which they don't allow anymore. I worked for Lyon County as a public health nurse for 5 years, and that was a wide variety of things, working with elderly, a lot of chronic illness, people with MS, where we'd change catheters, do B12 shots, and IV cortisone they'd go into the hospital for, and that's about the only treatments they had back then for MS.
My nursing journey between my third and fourth year, I was a summer 3 intern in Methodist Hospital in Rochester, and that was really fun. Met some great people, worked some different shifts, just kind of got out of, the routine. Then when I graduated from St. Ben's, took the boards and went back to Iowa, where I'm from. Worked in a med-surg floor in Ames, Iowa, and got my feet on the ground, kind of got my, figured out what it was I wanted to do. Then I moved back to the Twin Cities I went to Europe for about 6 to 8 months and did some traveling, because at least when I was here during nursing school, that was something you couldn't do. So I decided to kind of do a little trip on my own, took some other Benny friends with me, and we had a great time. So came back, started in the surgical intensive care at the University of Minnesota. It was a very great place to work. They had a new grad program. So even though I wasn't necessarily a new grad, I was a new ICU grad. And it was probably 3 to 4 months long. Meanwhile, I'm still taking care of patients and working rotating shifts and what have you.
Right after I graduated, I started at North Memorial Hospital. It's a level 1 trauma center down in Robbinsdale. I didn't start in the ER or anything. I started on a heart and vascular floor, so we got chest pains, CHF, COPD, vascular, like if they need grafts to the lower legs, all that.
The summer between my junior and senior year, I did an internship at the St. Cloud Hospital on the medical oncology floor. And then when I graduated, I actually ended up getting a job on the medical floor. I worked on the medical floor for about a year, and then I went to, and at that time at the St. Cloud Hospital, medical and oncology were kind of, the nurses all rotated between there. After my first year, I became a chemo-certified nurse, so I went through all the training to be able to give chemotherapy. And I ended up actually getting mandated a few times to stay overnight because I was the only chemo-certified nurse, so I decided I didn't want to do that anymore because I didn't want to get mandated. So then I ended up going to the medical progressive care unit, opened up in the St. Cloud Hospital, and so it was kind of like the step-down ICU. So I went there and ended up working at the hospital for about 5 years. In between that time, I had gotten married, and I decided, I really didn't want to do the nights, the weekends, the holidays, and stuff like that, so I wanted to look for something a little different. So since then, I've actually been over at Health Partners in Sartell, and I love it, where we actually have our own panel of patients. Right now, I have about 28 to 30 patients that are my panel that I keep in contact with. So I work alongside with the doctor, but I also work alongside. Most of these patients have some type of home care or mental health provider or something that we need to kind of help coordinate their care. I do some with family practice, but then I also do pediatrics. So I have a lot of pediatric children. A couple of them go down to children's, so I need to coordinate their care to make sure that they're making their follow-up appointments, things like that.
When I worked at Fairview Riverside, I was on the call rotation. That's not necessarily always something you have to do, but it's a combination of 10, 12, 16, and 24-hour shifts. And but with doing the longer shifts, you get, you know, it's a rotating schedule, so it's a 12-week schedule that just repeats itself. So you can plan your life out, you know, 9 months ahead of time. And in every fourth week, you'd have the whole week off, which, because you would have already banked those
I
hours.
would say that, yeah, it's a lot different now. Like, there's not, I know at North, they do every once in a while do have new grad positions, but it's very limited now than what it used to be. Like, all of a sudden there'll be like, there's 10 positions, and that doesn't happen every 3 times a year. But I think a lot of times that they just even want a year in some place, and I think my advice is you may not 100% like where your first job is, but, you know, get what you can out of it, put the time in so you can get a good recommendation, and then you can always move on. Just don't stay there for over a year, 2 years, 3 years, if you really don't like it. But you may like your first job and want to stay a while. I didn't know what I was getting into when I got my first job, and didn't even interview with the same manager, but then I was there for 6 years until I moved on. So I got to know the people I worked with and learned a lot from them, so that was good.
And I would just say apply. Pretty much to anything that you can, if it even remotely interests you. Like he said, you know, it may not be your first choice, but it may be something that, okay, maybe I can see myself getting in there, and then you never know what it could turn out or what doors it could open up for you. So the more you apply, the more chances you have.
And don't be afraid to put someone's name down that says, oh, if they say you can, like, should I put this person's name down on my resume? If they said you can, put it down, because that may, if they have 20 resumes and this name gets you an interview, that can make the difference of maybe not getting a job, but at least having to sit down face to face with someone. So that can always help.
And I think connections is another big thing, like, you know, either through your parents, somebody that they work with, you know, may work at a clinic, or at your church, somebody knows that you're graduating and they might have a relative that lives wherever, and wow, she just heard they need a nurse. You know, I think networking is really, really important. And I know it's tough when you're first getting out of school because your world has been pretty small, but if you have a chance to network, I think it can really make a big difference. So, you know, the saying, it's not what you know, it's who you know. And I think these days, who you know really can make the difference between getting a job and not.